Morning, everyone. I want to be conscious of this being a session day, and we have session in an hour, so I want to make sure we have enough time for today's informational hearing. I'd like to call this informational meeting today of the House on Children and Youth Committee to order. And please remind everyone to silence your cell phones. And if you are using the microphone, to please make sure that the green light is on and you're speaking into the mic so we can all hear you. To get started, I would like to ask Brooke to please take the roll.
Chair Bullock,
Present.
Chair Joswiak, here. Representatives Bellman, Boyd, here. Serrato, Curry, Fink, Fleming, Flick, Grim-Krupa, Genst, Hambidge, Hogan, Howard, Kazim, Krajewski, Kutz, McKenzie, McAndrew, Nelson, Powell, Rossi, Schlegel.
Great.
You have a quorum.
Thank you, Brooke. With an informational hearing, I just would like to actually give our guest today the benefit of knowing who we all are. So if we could briefly just introduce yourself with your district. So I'm Representative Donna Bullock, Chair of the Children and Youth Committee, and I represent the 195th Legislative District out of Philadelphia.
Morning. Harry Joswiak. I'm from Berks County, 5th District, and I'm the Republican chair.
Hi, I'm Joy Stockbauer. I'm a policy analyst for the Republican House Children and Youth Committee.
Hi, I'm Brooke Kennedy. I'm also a policy analyst with the Republican Caucus for Children and Youth Committee.
Dave Zimmerman, represent Northeast Lancaster County and Southern Berks.
Jamie Flick, thank you for being here. I'm from Lycoming and parts of Union County.
Dane Watrow, representing Luzerne and Schuylkill counties. Thank you.
I'm Charity Grim-Krupa, and I'm from Southern Fayette County.
Good morning. I'm John Schlegel, represent the 101st District in the heart of Lebanon County.
Hi, I'm Heather Boyd, representing the 163rd District in Delaware County.
Christine Howard from the 167th in Chester County.
I represent the 102nd District.
Brooke Heckard with the Democratic Caucus.
Stacy Trier with the Democratic Caucus Children and Youth Committee. I'm the research analyst.
Thank you. Good morning, everyone. My name is Danielle Bowers. I serve as the Democratic Executive Director of the House Children and Youth Committee.
Thank you, Danielle. You had mics on mics there for a minute. So again, thank you all for joining us for today's informational hearing. Today, we will take this time to learn more about the role of the Office of the Child Advocate, and we are joined by a guest. But before our guest shares her remark, I would like to offer an opportunity for my partner here, Chair Joswiak, to offer some opening remarks as well.
Thank you, Chairwoman. So every child deserves to grow up in a safe, stable, and caring environment. And I'm grateful to serve in this committee, charged with advancing the well-being of our children across the Commonwealth of Pennsylvania. And I want to extend my thanks to Mrs. McElvoy for being here today. And I look forward to hearing your testimony and the conversation regarding the Office of Child Advocate. Thank you.
Thank you, Chair Joswiak. I concur that we want to work together to make sure that every child has an opportunity to grow and develop into the young person that they are, want to be and are intended to be. And we need to do our jobs as grown-ups, right? And often the children are relying on us to do right by them. And I think it's important that we have voices that are in this building and throughout the state speaking for them, and whether it's ours or others, that we have a responsibility, and our children are depending on us to do right. So I look forward to hearing, again, Dr. McEvoy's testimony. And so, again, we are enjoined today by Dr. Marianne McEvoy. Am I pronouncing your last name right? McAvoy, thank you. She's the executive director of the Child Advocate for the Office of Advocacy and Reform, the office of, through our governor, Josh Shapiro. Dr. McAvoy, did I get it right that time? The floor is yours.
I had a feel. There we go. I had a feeling. Okay. Thank you so much, first, Chairs Jazwiak and Block, for having me today, and thank you to all of you for prioritizing this meeting and being here for this discussion. I'm going to start with just a little bit of a history behind the position. About 3 years ago, I stepped into the role of child advocate for Pennsylvania, and I had really no idea when I accepted it how much of an honor it was going to be. The position was created out of executive order by Governor Wolf in 2019 after several congregate care facilities were flagged for complaints of abuses to children, and there were a lot of news outlets reporting about an alarming increase in our child fatalities from abuse and neglect. So over the past 3 years, I've sat on several state-level working groups. I've supported a variety of community-based initiatives. I've encouraged collaboration across all state agencies on a variety of child protection topics like human trafficking prevention, child abuse registry reform, trauma-informed policy development, ACEs awareness, we could go on. But there have been some limitations that I have experienced being created out of executive order. And I'm going to share both the successes and some of the barriers because I think they're both really important to talk about. So first, I'd like to share a few specific successes with the committee, starting with the development and implementation of various different resources to prevent adverse childhood experiences in Pennsylvania. At a macro level, I worked with a team of professionals within the Office of Advocacy and Reform, which is where my position was housed, to create the Trauma-Informed Pennsylvania Plan. That was published, and it's still being utilized as a roadmap for our agencies to reform their policies and their practices from the lens of adverse childhood experiences and the impact that they have on our public health and our public safety. Additionally, once we published that plan, I worked with a variety of stakeholders to create HEAL PA, which is a statewide trauma-informed coalition. We have over 300 experts volunteering their time on that coalition and over 3,000 community members that disseminate free resources and support throughout the Commonwealth. We partner with Resilient PA, United Way of Pennsylvania, to be able to do that work. In addition, to managing the statewide coalition, I've visited over 400 of our 600 OCY licensed residential facilities. And while I was there, I've spoken to children, staff, leadership, and various different county children and youth agencies. While I was there, I provided the history of the position, much like I am today, and I provided everyone with the contact information for the office. I also received feedback from youth and leadership at the facilities about what they needed in a child advocate. The concerns that have been brought to my office have been from children, families, kinship providers, caseworkers, county children and youth administrators, various different walks of life. And they've all felt like they didn't have anywhere they could currently turn to in their systems for support. All of their concerns required a deeper look into a variety of supports from several Commonwealth agencies, such as DDAP, DHS, PDE, many others. And sometimes the outreach provided the opportunity to direct those constituents to resources that did in fact exist. But other times the outreach led to a review of data across multiple agencies to determine where our process gaps and our breakdowns in child protection as a whole really were stemming from. And the goal of those efforts was really to make better informed decisions on how to change our policies and our practices to more effectively protect our children. At times, the process was successful. For example, we've had many complaints received that have included both child welfare and the education system. And during some of those complaint resolution calls, it became apparent that some of the common behavior intervention practices and language that we use in these different systems contradicted with one another. So, for example, a child being secluded in a room is sometimes a crisis intervention strategy in the juvenile justice system. In the schools, that's really a last resort. They would potentially utilize restraint first. In the child welfare system, restraint is seen as more intrusive than seclusion. So in some of those calls, having to kind of iron out those differences and make better recommendations of how we could support our children during crisis situations was really beneficial. But it often only resulted in kind of provision of further training for school staff and an acknowledgement from different systems that, yes, we're viewing the same concerns from very different lenses, and where do we go from there now that we know that? And that kind of leads me to our barriers. So when a complaint, a concern, or a request for assistance comes into the office, right now I make sure that the grievance channels that were already available to the constituent have been utilized. As long as they have, then following the initial complaint, I review their concern, and I request that each agency that's involved in the concern investigate. Once those investigations are done, I coordinate a multi-agency meeting to review the outcome. One of the challenges that I've noticed in this process, though, is that multiple agencies, by conducting simultaneous investigations, they're conducting them from the lens of their own systems. Because of that, it's difficult to provide any holistic, truly independent recommendation from a third party that has viewed the concern from all these different angles. Sometimes that can lead to disjointed recommendations and limited real-time support for the people who reach out to our office. So there are a lot of opportunities, though. One of the really important aspects that I feel in my role has been to be a voice for our children on the United States Ombudsman Association. So over the past 2 years, I have been a member of that association. And what I learned about other child advocate offices in other states is that they do act as a resource, not just for children, but for all constituents who reach out to their office concerned about child protection. But they also receive feedback from child welfare professionals, medical staff, family courts, a variety of individuals. And that is something that I've been able to do in my role. Just for your knowledge, I've received concerns from children, caregivers, school staff, district attorneys, judges, all walks of life. And the concerns have been for overarching child protection in Pennsylvania, including the impact of substance use, mental health, suicide, foster and kinship care support barriers, et cetera. But unfortunately, being developed by executive order creates a lot of limitations in how our office can respond to those concerns. For instance, in other states, ombuds offices are developed out of statute rather than executive order, and they can conduct independent reviews and coordinate systemic approaches to child abuse prevention. For example, Colorado's Children's Ombudsman Office has been convening a mandatory reporting task force aimed at producing recommendations to improve the state's mandatory reporting laws. Additionally, others are able to publish systemic findings, such as New Hampshire's Office of Child Advocate out-of-state residential facility brief. In this way, when developed in statute, the office has access to a variety of information and records from different systems related to their children, and they can enhance the support that the children receive across various systems within their states. So over the past 3 years, I have dedicated my career to being a resource, a sounding board, and a voice at every state table I can for our children. However, the extensive research and the advocacy that I've been doing related to child advocate offices across the nation has been, I believe, the most critical component of my work. And I'm looking very forward to seeing what the future of an Office of Child Advocate could look like for Pennsylvania. So thank you very much for having me.
Thank you, Dr. McAvoy. I know that we've been joined by a few members since you started your testimony, so I'll ask that they briefly introduce themselves. Starting with Representative Hogan.
Good morning, Representative Joe Hogan from Bucks County.
Representative Anthony Bellman from Philadelphia County.
Okay. Thank you. I believe that is everyone. So are you able to take a few questions? Sure. Great. So one of the questions that I had was, you mentioned a few of the other states. Are there particular models that you think Pennsylvania should take a strong look at, or who's doing it best, best practices? Anything you want to share a little bit more about what this looks like in other states?
Yeah, you know what? When I started in this role, one of the most important things I realized, the conversations kept coming back to, we want a child advocate, we want to be able to better support our children with this role. We've never had it before. What does the scope of work need to look like? And we needed to define that a bit. And I couldn't answer that question without talking to a lot of different stakeholders in Pennsylvania. So I spoke to nearly all of our state senators, and I spoke to people who had been advocating for this type of a role for decades. But I also really wanted to talk to people who weren't sure that it was the right move for Pennsylvania, so I wanted to learn from them. And what they shared with me was that there was indeed a model that they felt was very effective that was being utilized in Colorado. So Stephanie Villafuerte is the children's ombudsman in Colorado, and I got to know her very, very well, and she became a mentor to me. So I've done a lot of work to really understand how they developed their office, the history behind their own successes and their own barriers. And she's the one who said, you know, you really need to join the United States Ombudsman Association because Colorado is one model, but you really should be looking at many other states. That said, with all of the states that I have worked with, I've remained very close to Stephanie, and I do admire the model that they utilize. I think they're very impactful for their children. And I hope, I mean, we've had a lot of meetings with their teams, so as we talk about what this could look like, that is the voice when we think about from a national lens that I've continued to bring to the table.
Chair Josbeck, do you have any questions?
I got a lot of questions.
Sure, we'll go back and forth. Go ahead, start.
No, I'm sure the members have questions too.
Sure.
I'm going to roll a couple questions into one.
Sure.
So how specifically do you recommend that the office be structured? How many staff people are you looking to have? And what's the proposed costs, you know, to run an effective office?
Yeah, those are really important questions. I believe that of the different offices that I've met with in other states, they've all started a little bit differently. As far as the staffing needs, it would be ideal to have ombuds people situated throughout the Commonwealth. The budget that I outlined is less than $2 million to start up this type of an office. And then I believe there was a question in the beginning, though, that I may have missed, Chair Joswiak.
Well, I asked you how it would be structured, but what your staffing is what I'm concerned with.
Sure.
You gave a really general answer there. So
Sure.
Are you talking about one person per county, or what are you talking
No. I'm thinking more of a regional approach. Those are the discussions that we've had. But I also think that that's still all up for discussion, and it's not something that I alone or one individual alone could decide. So I think it's something that we'd have to talk about with Gov's team and all of you on what the best approach would be. I personally have learned that a regional approach in other states have worked. We're much larger than New Hampshire, right? So it might have to look a little bit different here. But as far as kind of central staff, having a state level advocate and deputy, kind of the typical staff that they would utilize. It also depends on where the office sits. There may be an opportunity to utilize some resources that are already present to support that office. So I think there's just a lot of discussion that can be had there, and we'll probably have to meet to kind of hash that out further as we continue to move down the road.
I'm sorry, Chairman, just follow. Can you share what the staffing looks like right now?
I am the only individual working in this office right now.
Thank you.
Previously, I was working within the Office of Advocacy and Reform, and at one point, I believe we had up to 9 staff. That was under Governor Wolf. When the transition occurred, we did lose those staff. So I am your child advocate. I will say, though, it sounds really daunting, and I actually appreciate that you recognize how tough that may have been, but I've had really incredible supports. The Shapiro administration's been an amazing support to me. I mentioned briefly HEAL PA. 300 volunteers is not something to discredit. We have a team that is really dedicated to ACEs prevention. and seeing this kind of work through. And right now, we don't have the authority to do really micro-level investigations and things like that, but we can provide recommendations and support prevention work at a systems level to a point. And that's what all of those volunteers have been so dedicated in helping us do. So it was nice to see Stacy here because that is how she and I met.
Chairman Drasberg, I know you wanted to follow up.
Yeah, I just have one more question for now.
Sure.
You said a $2 million startup. What do you envision the budget to actually be? And maybe you're going to compare it to Colorado. What's their budget?
Well, Colorado's been around for a very long time, so they've had the ability to show the outcomes and generate more money in their budget to expand their office. When they started at about $1.5 million. The exact number in the budget that I proposed was 1.8, so it was right around there. It includes a couple things that Colorado didn't include in their first year, because in talking with them, they said, man, you really should get these types of things in place first, like a case management system, things like that. But it is a very fiscally responsible budget, I believe, to start this up, especially if it wants to be started up with a regional approach with ombudspeople throughout Pennsylvania, because then we're talking about 6 individuals in addition to the child advocate, and then any needs that they might have for case management system, travel, things like that.
Representative Grimm-Krupa.
Thank you, Madam Chair. And thank you to the testifier. Thank you for coming and sharing your expertise. I'm looking at a letter that's dated March 8th, 2024. It's authored by, or at least signed off by, the Pennsylvania Children and Youth Administrators, Pennsylvania Family Support Alliance, Pennsylvania Council of Children, Youth, and Family Services, Rehabilitation and Community Providers Association, and they're advocating, and of course they voice their agreement with the underlying issue and that there's definitely a need. What they are proposing is a children's cabinet, and the letter indicates that it's recommended by the National Governors Association Center for Best Practices. It describes it generically as a collaborative across multiple state agencies and departments. How is what you're proposing different than this children's cabinet? And I do have a couple follow-up questions as well, but.
Yeah. So I'm aware of the call for a children's cabinet, and I wouldn't discredit it at all, but I don't think that it's an either or, because it's very different. So an Office of Child Advocate is a resource for our children, really any constituent, to reach out directly to a third-party entity to look into more micro-level concerns, and then speak to how they're impacted by our macro-level decisions, right? So to me, they would work very nicely together in tandem. The cabinet, in my opinion, I think it still needs to be hashed out a little bit. I don't really understand the structure or what their goals are specifically, but it seems to me like their goal would be systemic child abuse prevention, right? Without an office that's looking at a more micro level at what the concerns are directly from our constituents, how are we going to inform those conversations? So I don't think it's an either or. I think that it should be a really good partnership. And some of those organizations that you name are actually the ones that I went to hoping to get some advice of, okay, what would make this kind of an office work? And that's what led me to the Colorado Ombudsman's Office and USOA, so.
And the letter does a good job of referencing the multiple state entities that are already monitoring or should be policing these issues. Lists the Pennsylvania Auditor General's Office, the Pennsylvania Department of Human Services, Office of Children, Youth, and Families, the Department of Human Services, Office of Mental Health and Substance Abuse Services, Pennsylvania Department of Health, Pennsylvania Department of Education, Behavioral Health Managed Care Organizations, multiple departments within a county. So with all of these state agencies, what is it that you believe that your program could do that these different agencies are failing to do?
I wouldn't say that they're failing to do what they're intending to do. I think they're doing exactly what they're developed to do. The problem is that it isn't always working. So my response to that is that there needs to be, and I don't want to say this as if this is my recommendation. I want to acknowledge that several of the names that have signed off on that letter have been part of a number of working groups that I've sat on. And the end result of so many of those working groups has included a recommendation to improve our information sharing across agencies. So they can all do their independent reviews, right? But we can't share unredacted documents pertaining to a case with each other. Not being able to have an entity, like an independent entity, to look across all these systems, to read the whole story all together. Imagine if you have one person reading one chapter of a book, one person reading chapter 2, chapter 3, chapter 4, chapter 5. Now our goal is to all come back together and tell each other the story. Like, what was the whole story? That's going to, it's like whisper down the lane a little bit. We need a holistic.
So generally speaking, I believe less government is better. And,
Sure.
and I totally understand the need and the desire and that there has to be agencies overseeing this. But I guess my question is more specific in terms of, and it possibly could be fixed via, if the issue is that there's an inability by law to information share, could that not be fixed by proposing legislation that would permit the agencies to share those rather than growing government?
So that's a great question, and I would have to say that my belief is that if that was as easy of a fix as you're saying, we wouldn't be seeing that same recommendation over and over and over the years.
To your knowledge, has anybody ever pursued enacting a law that would make the information sharing possible?
Here in Pennsylvania, I believe that there are different working groups where they're able to sign certain confidentiality agreements and see certain things. We had a child fatality and near fatality working group where we were able to see certain information. However, it wasn't fully unredacted.
And that sharing of information would be something that would be possible under the recommended children's cabinet?
That would be something that you would have to have more conversations with those stakeholders about.
Thank you for your expertise.
Of course.
Thank you, Representative. Representative Slagle.
Thank you, Madam Chair. I want to take this opportunity to talk about an aspect of your advocacy that I'm sure you work closely with at the county levels. It has to do with children and youth agencies. And I think that those folks, from my experience as an educator and working with them, do a wonderful job on helping support children in our school systems. And I don't necessarily know that that's their number one job, but they certainly have always been willing to roll up their sleeves and do whatever they can to help us as educators to help those children get the best education possible. Staffing is always an issue. And I was just wondering, from your experience, from your office, do you have any suggestions on how we can address the staffing issues? This could probably apply to any number of agencies, but I'm really focusing on children and youth.
Well, being a children and youth caseworker comes with the potential guarantee, not potential, of a lot of vicarious trauma in and of itself. And I don't want to sit here and claim to be an expert on how to fix our workforce issues within that system, but I will say that we need to provide them more support. They're in crisis right now. I mean, Secretary Arkush mentioned that during the Senate budget hearings a few weeks ago. That's another reason why this office could be so beneficial. And I couldn't agree more with being careful about increasing the size of government too much. But we're talking about doing it in a very prudent way. I think that part of the problem, particularly when it comes to this office and discussing the impact it could have on our caseworkers, is that in previous years, the position was looked at as media outlets used it to the term watchdog and things like that. That's not at all, if it's going to be successful, what the intention should be. The intention should be to find solutions to more systemic issues like you just raised. I will say that I've worked very closely on some of our Act 33 review teams, and I've heard caseworkers say to me, I dread going to these meetings because it's my worst nightmare. I just feel like it's my fault. We lost a child, and now we've got to sit and talk for an hour about what I did wrong. That's not the intention behind those meetings. So I feel like I'm going a little bit beyond your question, but the answer is we need to make sure that as we move forward with the child advocate role, that we're doing so in a way that produces recommendations that will lessen that heavy load of being a caseworker, which could, one, hopefully keep more caseworkers in the role, or children youth administrators, keep people in that system, and in the education system, because you did mention schools too. Teachers are ready to leave too. A lot of teachers are walking out. How do we lessen the load on the people who are working in these systems by making those bigger reform recommendations?
Thank you.
Thank you, Representative. Next, we have Representative Howard.
Hi. First of all, I want to thank Rep. Schlegel for bringing that up in your comments. I worked for a county CYF agency for 2 years before I was elected, so I certainly agree with all that, the vicarious trauma, the understaffing. But at root, that's a bureaucracy with a very narrow mandate. That may be part of the problem. So, but I want to address what Rep. Grim Krupa was talking about, the Children's Cabinet, and that it's really the multiple facets of the state bureaucracy, which is, I gather, a different thing. So what I would like to focus in on is, could you give us some examples of exactly, some requests you get for assistance? I know that we're all familiar with our constituents calling us desperate because of their negative experiences dealing with the state bureaucracy. They need help. So could you explain, what is it similar? Please give us some examples of outreach that you get from individuals.
Yeah. It really does vary because, like I said, I get a variety of individuals reaching out. I can give you an example that happened last year where I actually worked very closely with our previous Deputy Secretary, John Rubin, to try to support the family. There was an adopted parent who reached out, and she learned that the sibling to her adopted son was currently in the foster care system. And she had let the agency know that she was available to provide care for that child until they found a permanent home, potentially even be the permanent home. But for reasons she was not aware of, she was told she would not be taken under consideration. So we did pen a letter. We made sure that we reiterated that the research really does say that we want to keep siblings together. Here's what would be a best case scenario outcome for this particular family. And we sent it off to that county. That being said, though, that's also an example of a limitation. I can write out a recommendation. I can't tell that county to do anything differently on behalf of that child, but I certainly can hopefully facilitate conversations to make a difference for that one individual child and that one family. So that's one example. I get a lot of outreach related to child sexual abuse concerns. I very often then work closely with the local CACs, make sure that everything has been coordinated in that respect, that the child's been seen by a CAC. If they haven't, how far is the closest one? So that's kind of an example that I shared before about there are times where there are resources available that our constituents aren't aware of. So when they reach out to me, I'm able to connect them with those. Same thing with our CASAs. We get a variety of different outreach, and I do my best to, when there is a larger concern, bring it to the state leaders involved who could potentially help make a change or help pen a letter or hold a meeting to kind of discuss why we're seeing this concern and what does it mean for the larger picture of child protection, not just this one family, because if this one family is experiencing it, chances are many, many others are. But that's right now being created out of executive order. That's kind of the limit to what I'm able to do.
Thank you, Representative Howard. Thank you. Our next question will come from Representative Hogan.
Thank you, Madam Chair. So my question actually dovetails off the last two here. And my sense after listening to your remarks is that you're kind of hamstring because it's just an executive order, that right now it's more of developing best practices or just being a mediator with no real official capacity. Is that accurate?
That is accurate.
So what if legislation was enacted to further empower this office, how do you envision, or how have other states envisioned this role interacting specifically with county children and youth agencies?
I think that's a really great question, but being that the legislation's pending, I think that that could be a whole different meeting in and of itself. So I would love to maybe get another meeting on the books with the governor's legislative team and various other staff members to have that conversation respectfully.
Well, that was a good response. But so would it be, I mean, do you envision it, or does Colorado work with where it's more of, again, developing best practices and working with the children and youth, or stepping in where maybe a caseworker had done something inappropriately, like, for instance, you know, at a allegation of abuse, suggesting to the other spouse that somebody's preparing for divorce and to prepare themselves for it? Would that be a role where hypothetically this office would step in?
I can speak to how Colorado functions, if you'd
Okay.
like. In Colorado, when a complaint is received, they're able to request documents from whatever entity they may need to request the documents from that's involved in the concern. They can read fatality reports, they can read CAC reports, anything that might be relevant to their investigation into that concern. Once their investigation's completed, they then can issue a report with recommendations to changes that could be made to prevent that concern from happening again. Prior to issuing that report, though, the reason they have a good relationship with all their different state agencies is they provide that report to the agencies. So it gives them the opportunity to go ahead and institute those changes fairly quickly. And then the actual final report speaks to, here's what our recommendations are, and here's what all your agencies did to really respond to those concerns. So that's how they work collaboratively and very positively with the various different state agencies when a concern comes through.
Thank you.
Of course.
Thank you, Representative Hogan. Next question is from Representative Nelson.
Thank you. I'm thrilled to hear about HEAL PA, and thank you for mentioning them. I've worked with HEAL PA on a number of items, including trying to expand the number of school districts and counties that are using the Safe to Say program to expand our handle with care capacities in Pennsylvania. And I actually also have, for Representative Krupa, a couple pieces of legislation around how we're able to share information and trying to open up, floodgates is not the word, but open up the information sharing process. I think House bills specifically around this 2101 and 2110 that I'm working on titling issues with my LA, but they talk about how we're able to share information from children and youth organizations to school districts. It's important, though, that we mention, and so I'm going to try and hopefully we'll play along here. If we do this, if we were to institute and just kind of legislate the creation and powers of the Office of Child Advocate at the state level, are we certain that that's going to help solve our issues around information sharing and the advocacy of children in Pennsylvania?
Related to legislation, I do want to say that specifics to the legislation would have to be a separate conversation with the Gov's office.
Sure.
I will say that in other states, the ability to have an independent advocate who can see unredacted, not just share certain information or a certain extent of information, but truly see unredacted documents across any agency that needs to provide such documents, has created positive outcomes for their children.
But are there other options that could also work?
I'm sure that if you met with any of the child advocates in other states, they would say that they're part of a puzzle of child protection. So I certainly would never sit here as a professional to say that there are not other things that could help protect our children. But given the research that I've done in this area, I believe that an independent ombudsperson is a very important piece to that puzzle for all of our states. We're one of very few states that have not done this yet. Idaho just did it yesterday, by the way. They signed off, and we're now one of 6, I believe, that have not. So I want to keep my answer somewhat brief. That is, my professional opinion, given the research that I've done in this area. I will never say that there are other types of work that we can be doing that could also act as a piece to the puzzle, but we all kind of have to come together, and we all have different roles to play.
And I think that's the important takeaway, right? Is I don't know that it would have been irresponsible from my perspective to say, yes, this is going to be the answer.
Right.
Because what we're dealing with involves almost a little bit of art.
Yeah.
It's not all an exact science of how to best advocate for children in
Right.
Pennsylvania. Doing nothing is not a good idea.
Right.
Doing the same thing is not a good idea. Doing something, especially if it's backed by research, that helps us move in the right direction, would absolutely have my support, right? So I think continuing to work on this, because it's something that we have seen in other states that has worked, it will have flaws. There will be something else that we will need to add on to it. There may be something else that really works with how this office would really direct other children and youth organizations, how this office works with our court system. That will be critical.
Absolutely.
But doing nothing would be a critical flaw. And so I think it's important that as we continue to think about your request or this request to establish this office, that we do so not seeking certainty, but seeking research to suggest that there's good evidence behind this. And so I'm looking forward to working with you in this efforts, as well as all of the other legislative efforts in this space.
I appreciate your recognition that this really is not an either-or situation. I think that individuals who may feel that there's an either-or situation, I would be wary too. Child protection is a very complex issue. So how are we going to develop one or more tables that can work together towards that common goal? Thank you very much.
Thank you, Representative Nelson. We have 2 more members with questions, and then the chairman and I may have some follow-up questions to close us out for the day. We will start with Representative Watrow, and then following Representative Watrow, Representative Flick.
Madam Chair, thank you. Doctor, thank you for your testimony. 2 questions. Your involvement with children and youth from each county, not each county, but overall children and youth relationship you have. And do you see your relationship or the way the counties operate differ from county to county?
Of course I do. As far as the relationships that I have with different county children and youth, it's like any relationship you would expect. This is going to be really driven by that county's agency. There are some counties where they reach out frequently. We work very closely on different programs. One that I can think of right now that's their previous children and youth administrator, and actually she was later a commissioner, is working on creating a human trafficking, like a residential facility for victims of human trafficking. So she's been working closely with me because I have a background in that work. There have been really positive relationships built, and those Act 33 meetings that I talked about, sitting in on those meetings and very much so wanting to be a fly on the wall because I wanted to learn from them. I wasn't coming in to tell them how to do things. A lot of those meetings, I left and they said, well, could your office help us with this? Could you do this? Could you do that? I said, that's a great idea. You should recommend it. So it's driven by the county and what they need out of a child advocate. So that's what I've been trying to be at each individual table. Of course, thank you for that question.
Do you have a second question, or that was it? Okay. Representative Flick?
Thank you, Chairwoman, and thank you, Doctor. couple people have brought up the outcomes in the multiple state agencies, which is quite a challenge in Pennsylvania, I can tell you. So in my spare time, I write software. We all have a hobby, but so I write human services software for 61 of the 67 counties. And I can tell you what happens in Heather Boyd's county of Delaware, where the mental health agency and the drug and alcohol agency actually talk to each other is a good thing. What happens in Dane's district might be a little different. We've had to go to extreme measures in my counties, Lycoming County and Clinton County, which is a joinder for the MH and the DNA, to get them to share data. We actually had to write MOUs. And I know this is more human services than children and youth, but it all ties together. So if you look at the very top and you look at Octal, they use a Pelican piece of software, if you're familiar with that. OMSOS uses HCSIS. DDAP uses a system that's about to disappear, WITS. The court system, the juvenile court system, uses, I think, UJS. So there's all these different data elements. And for you to try to get them, of those 61 counties, I only have 4 counties that have agreed to share a database. 4 out of 61, and I could name them, obviously, on one hand. But that needs to change at the highest level. We've got to get DDAP and OMSOS to work together. In Colorado, they work together, all right, their agencies. In most states, they work together. So us being a Commonwealth, we really need to take a serious look, and it seems like every time a new governor comes in, that's the thought process, right? Let's share this data. Let's get together and do what's best for not only the kids, but for anybody that sits in that database. Children and youth, of course, brings a whole new challenge to that legally and with the data being protected.
Right.
So I don't know if I really have a question, but if you want to entertain any thoughts of what I just said, that'd be great.
No, I think that you may have said it better than I did when Representative Krupa was asking, well, couldn't we do something to change that right now? It's not that simple. And there's a lot of intention. I think everybody's on the same page in what we want to be able to do. But there are laws in place that are very important to protect the confidentiality of our children that you don't necessarily want to change, right? Because if you change them, then we might have unintended consequences. By doing something a little bit more unique like this that other states have done, it creates an avenue for that holistic review without creating the complications of potentially breaching confidentiality for a child.
Yeah, I'll follow up on that. So one thing,
Yeah.
I did mention the MOU, so I want to protect myself here. So none of it's identifiable information. So we don't bring in names or birth dates or social security. But for the outcomes, getting, again, MH and DNA in Lycoming County and the county court system with, several years ago, there was a Stepping Up initiative that people signed up for funding. And that worked really, really well. And again, I'm going down a different avenue here with recidivism rates, especially with children. So get them early. So thank you, Chairwoman.
Thank you. And I think, to your point, technology moves fast. And I think some of our departments have, we got the next greatest software. And by the time it's implemented, we're on to the next one. So definitely some work to do there to make sure that we are keeping up with the times, so to say, in regards to how we're serving Pennsylvanians and sharing information to do so. Doctor, I have a few questions I would like to ask, and then I'll allow my colleague to close with some closing remarks, and I'll close up after that. We talked about other states. Can you share with us, and you said we're one of 6 left to not have a similar office, where are some of the other states housing this office? They're independent office, but how independent are they? In some states, are they housed with a different agency? Can you just give us a lay of the landscape? Just what are some of the places that they're housed?
Sure.
Yeah.
They do need to have a great deal of autonomy and independence. Some are housed within their governor's offices, some within their inspector generals. Some are completely independent and report to various committees, legislative committees. It looks a little different state to state. So that is something that I'll go back to what I said before as we talk about future legislation. Probably best to have a whole separate meeting about with our legislative team. But
great. And then my second question is, we have a ombudsman in the Department of Aging, I believe. Can you share what similar qualities or roles between your office and the aging ombudsman, and how do you see, I guess, some parallels and maybe some differences?
Yeah, I actually worked with Margaret very closely, who's in that aging ombudsman office when we were in the Office of Advocacy and Reform together. And the structure, I think, is really ideal, which is why we started to talk about that regional ombuds structure, to make sure that we could respond to concerns specifically in residential facilities. So, similar to the way the aging ombudsperson would respond to concerns in some of our aging facilities. Slightly different in that just the content is a bit more complex when we're talking about children and the various different systems that they are going to interact with. So there is that piece of just research, investigation, review that would happen on individual complaints that might be a little bit more extensive than what the aging ombuds office currently does. But the structure, very similar.
Thank you. That's very helpful. Chairman Joswiak, would you like to close with some remarks?
Yes, thank you. Mrs. McAvoy, thanks for being here.
Of course.
There's a lot for us to learn on this
Yeah.
before we start creating another agency.
Sure.
But I really want to thank the members here today for asking the really good questions that they did ask. And I learned a lot sitting here, and I just want to thank everybody for your input. Thank you.
Thank you, Chairman Joswiak. And again, thank you to you, Dr. McAvoy, for taking this time to share with us the role of your office and the research that you have done into the importance of an Office of the Child Advocate. I, too, would like to thank the members for thinking and being thoughtful about your questions today to help get more information as we review the necessity of an Office of the Child Advocate. I opened up saying that we needed to make sure that our children had a voice and that there was somebody speaking for them. And I often talk about every child needed someone who was crazy about them and will do absolutely anything for them to make sure that they know that they are loved and they have someone speaking for them. And it's good to know that we have somebody in Pennsylvania that I would like to say is crazy about every single child in Pennsylvania. And so thank you for your work. And we look forward to our continued conversations on this particular office and potential legislation in the future. Everyone, thank you for being here. Our meeting is now adjourned.
Thank you so much, everybody.